Good afternoon and welcome to the Assembly Committee on Health and Human Services. Would the Secretary please take the roll?
Assemblywoman Gonzalez. Here. Assemblywoman Gorlow. Here. Assemblyman Gray. Assemblyman Hafen. Here. Assemblyman Hibbets. Here. Assemblyman Koenig. Here. Assemblywoman Newby. Here. Assemblyman Wynn. Here. Assemblyman Orentliger. Here. Assemblywoman Taylor. Present. Assemblywoman Thomas. Here. Chair Peters.
I am here. Thank you so much, everyone. Please mark Assemblyman Gray as present if he was not here when we called his name. We have a couple of housekeeping items per our daily. Please check your electronic devices and make sure that they are muted or turned off so we're not interrupting folks. Members of the public may testify in a variety of ways, all of which are included on the agenda. You may also submit public comment in writing, either in addition to testifying or in lieu thereof. Written public testimony may be submitted. Written public testimony may be submitted before, during, or up to 24 hours after the meeting's adjournment. If you wish to testify in person, please go ahead and sign in by the door and leave a business card so we get accurate record of your name and can get a hold of you if we need to. If you do not testify, you may also wish to sign in so that we have a record of who is interested in particular bills in the event that we'd like to get in touch with you. To ensure an orderly flow of discussion, all comments, questions, and responses must go through me. Also, committee members must be recognized before me. Before you may speak. Additionally, I ask our presenters on the Zoom video call to leave your cameras off and microphones muted until it's your turn to present or if I direct any questions to you. When testifying in person, please turn the microphones on to speak and off to listen so we don't get a reverb in our recording. And with that, we'll move on to our agenda. We have a couple of bills and a work session on our agenda today. Since we have everybody here, I'm going to start us with our work session today. We have 3 bills on work session. We had 4 on the agenda, but we have moved 155 to another time. So we will start with Assembly Bill 281. Mr. Ashton.
Thank you, Chair Peters. For the record, Patrick Ashton, nonpartisan staff of the Research Division Legislative Council Bureau. Assembly Bill 281 was heard on March 24th and sets forth requirements for ventilation and filtration systems in senior living facilities that receive certain federal funding. The bill requires, to the extent of available funding, that a facility administrator ensures a functional ventilation system. Amendments. Assemblywoman Gorlow proposed the attached mock-up during the bill hearing. In summary, the mock-up amends the bill as follows. And members, items 1 through 6 of the amendment revise divisions in the bill. I want to mention that in item 2, it additionally requires on the bill page that DPPH, DHHS, reviews each new version of the mentioned standard, and unless DPPH issues a formal determination that the new version is not appropriate for the state within 90 days, the new version takes effect. In item 7, revised subsection 2 of section 10 to require a senior living facility administrator to employ or contract with certain persons to perform a ventilation verification assessment. In item 8, replace sections 11 through 17 with the following new provisions as outlined in items 8A through G on the bill page. And additionally, Nevada Hand proposes the amendments that are also attached to the work session document. Item 9, revised in section 10 that assisted living facilities certified by DPPH may utilize federal funding to upgrade and maintain their respective HVAC systems. And number 10, sunset the bill's provisions for such certified facilities when federal funding is no longer available. Thank you, Chair.
Thank you, Mr. Ashton. Are there any questions from the committee? Seeing none, I would entertain a motion to amend and do pass. A motion from Assemblywoman Gonzalez and a second from Assemblyman Wynn. Is there any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay? Nay. Raise your hands, please. Assemblyman Hafen, Assemblyman Koenig, Assemblyman Hibbets, and Assemblyman Gray are nays. The motion passes. I will assign that floor statement to Assemblywoman Gorlow, please.
Thank you.
Thank you. We'll move on to Assembly Bill 338. Mr. Ashton.
Assembly Bill 330, for the record, Patrick Ashton, Research Division, LCB. Assembly Bill 338 was heard on April 5th. It requires an art therapist who desires to receive reimbursement through the Medicaid program for the provision of art therapy services to a Medicaid recipient to enroll with Nevada Medicaid. Amendments. Ms. Broomfield proposed the attached conceptual amendment on behalf of notable music therapy services. In summary, the amendment revises Section 1 as follows. Number 1 replaces the definition of art therapy with creative arts therapy and define it in a certain manner as noted on the bill page. Number 2, in subsection 5b, revised the definition of enrolled art therapist to instead be enrolled creative arts therapist. And additionally, Chair Peters proposes the following conceptual amendment in item 3 of the bill page. Add authorization for the Nevada Arts Council to expend money from the Nevada Cultural Account to support programs and projects to improve health outcomes through the arts and humanities. Thank you, Chair.
Thank you, Mr. Ashton. Are there any questions from the committee? Seeing none, I would entertain a motion to amend and do pass. Thank you. I have a motion from Assemblywoman Taylor and a second from Assemblyman Nguyen. Is there any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay? Nay. Raise your hands, please. Assemblyman Hafen, Assemblyman Koenig, Assemblyman Hibbets, and Assemblyman Gray are nays. The motion passes. And I would assign that floor statement. I will take that one. All right, Assembly Bill 348, Mr. Ashton.
For the record, Patrick Ashton, Research Division, LCB. Assembly Bill 348 was heard on April 7th. It establishes the Virtual Early Childhood Family Engagement Pilot Program within DHHS with the purpose to empower, through training and coaching, parents and guardians of children who are 4 years of age, and to increase kindergarten readiness across Nevada. Amendments. Assemblywoman Torres proposed the conceptual amendments attached to the work session document during the bill hearing last Friday. And members, the only thing I want to note is that the amendment to Section 4 in the conceptual amendment will apply actually to Section 6, which is item 2 on the bill page. This change was clarified during the bill hearing, and this amendment adds a program requirement that twice during the program year and as requested by participating families, the selected organization administering the program shall provide by email and in writing information on certain state services and resources. So, Chair Peters.
Thank you, Mr. Ashton. Thank you, Mr. Ashton. Are there any questions from the committee? Seeing none, I would entertain a motion to amend and do pass. A motion from Assemblyman Nguyen. Second from Assemblywoman Newby. Or is there any discussion on the motion? Assemblyman Hafen, and then I'll go to you, Koenig. Go ahead. Assemblyman Koenig.
I'd like to vote yes, but reserve my right to change on the floor.
Thank you. Assemblyman Hafen? No?
Yeah, Madam Chair, I do have some concerns over how the appropriation works with some of the other bills that are floating around. I will vote this out today, but look forward to seeing how this works with within the other bills as it goes through Ways and Means. Thank you.
Thank you, Assemblyman Gray.
Yes, ma'am. I'm going to vote no today, but reserve my right to change it to a yes. I really like it. I just have some questions that I need to work through between now and the time it's the floor. Thank you.
Thank you. Yeah, this bill will end up going to Ways and Means, I believe, based on the appropriation request, so there'll be some time. Is there any other discussion? All of those in favor, please signify by saying aye. Aye. Any opposed, nay? Nay. And raise your hand. Assemblyman Gray and Assemblyman Hibbets are nays. Thank you. The motion passes, and I would assign that floor statement to Assemblywoman Torres. All right, moving on through. Okay, we have 2 bills on the agenda for today, so we'll close out work session and move into bill hearings. I'm going to take Assembly Bill 168 first. Yeah, All right, we're going to go ahead and open the hearing on Assembly Bill 168, which revises provisions governing the Maternal Mortality Review Committee in the Department of Health and Human Services. I want to mention to the committee that we have an amendment up on Nellis. Welcome, Assemblywoman. Great to have you back and at the desk. Please begin when you're ready.
And thank you, Chair Peters. Just one note. I think everyone received this conceptual amendment, which actually changes the title from maternal mortality. It creates its own program. So I'll get to that during my opening. All right? Okay, good. Thank you, Chair Peters and Vice Chair Ornlicker, and committee members. I am Claire Thomas, representing Assembly District 17 in beautiful North Las Vegas. I come before you this afternoon to present Assembly Bill 168, which through the Department of Health and Human Services shall establish a fetal and infant mortality review program. Before I begin, I would like to point out the reference exhibit, which you can find on the Nellis system. The exhibit lists 3 important informational links to data regarding infant mortality from the Peterson KFF Health Systems Tracker, racial disparities in maternal and infant health from the Kaiser Foundation, Family Foundation, and the latest 2020 National Vital Statistic Report on infant mortality from the CDC. I will be referring to Table 2 on pages 9 through 12 of the CDC report today. According to the Centers of Disease Control and Prevention report, infants of non-Hispanic Black women have the highest mortality rate, which is 10.38 per 1,000 live births, followed by infants of non-Hispanic American Indians and Alaska Natives, 7.68, Native Hawaiian and other Pacific Islanders, 7.17, Hispanic, 4.69, non-Hispanic White, 4.40, and non-Hispanic Asian, 3.14 women. The CDC noted that infants of non-Hispanic Black women also have had the highest neonatal mortality rate in 2020, 6.55, compared with infants of other races and Hispanic origin groups. The lowest mortality rate was for infants of non-Hispanic Asian women, 2.30. The CDC has determined that there is a direct correlation between the maternal mortality of Black, Brown, and Indigenous women and infant mortality of the same ethnic groups. In 2019, we gathered significant demographic information. Black women make up 11% of Nevada's population, of which they account for 33% of pregnancy-related deaths. Native American women represent just over 2% of the state population and account for 22% of pregnancy-related deaths. Rates of severe maternal morbidity among Black, Asian Pacific Islander, and Native American women are starkly similar at twice the rate of white women. Similar disparities exist for infants of color. Black infants and Native Hawaiian Pacific Islander infants are more than twice as likely to die as white or Hispanic infants. Infant mortality rates for Native American and Native Alaskan infants are not far behind. Based on this very real, grim data, it is essential that the state of Nevada review the racial, ethnic disparities in birth, infant-related death rates. There will not be a fiscal impact, but this is a policy committee, and this is good policy. It is with unabashed optimism that I am proposing Assembly Bill 168 in the hope that the Advisory Committee on Minority, Health, and Equity will receive and collect data from the Fetal and Infant Mortality Review Program to quantify and measure disparities in the incidence of preventable infant deaths affecting infants of color in Nevada, so that we can begin to develop solutions to this regrettable issue. And with that, Madam Chair, I'm open for questions.
Thank you for the presentation. I'm going to start with Assemblyman Nguyen.
Thank you, Chair, and thank you, Assemblywoman Thomas, for bringing this important group together to look at this. I'm just wondering on the amendment. It says to add, review the records of selected cases of death of children, and the changes is going to be from 1 to under 18 years of age. I wonder why we start at 1 versus just saying from birth to 18 years of age.
Clara Thomas for the record, and Madam Chair, may I go direct? Thank you. Thank you, Assemblyman Nguyen, for that question. Actually, I believe you're looking at the amendment NRS 432B.403. With that, it looks at children from the age of 1 through 18. But if you look at the initial, it looks at infants from 0 through 1. So part of this is looking at from 0 through 1, and that's generally what I'm looking for. But the Department of Health and Human Services, when they make their reports because of the review of looking at the records for those children that are 1 through 18, it looks at all of the deaths until they are 18, and then they look at older. So part of this review committee actually looks at birth through 1, and then the other half of the minority of health and equity, they actually look at 1 year through 18.
We have legal willing to weigh in on why there's an age difference kind of cut off there. Mr. Robbins.
Yes, Eric Robbins from the legal division. So the way I read this amendment, the first part, item 1, creates an entirely new program to establish a fetal and infant mortality review program to conduct a review of the deaths of fetuses and infants who are under 1 year of age. So then item 2 is really just a conforming change to the existing provisions governing child death review teams to avoid duplication. So basically, the new program is going to take reviewing the deaths of children under 1. And so to avoid duplication, we say that the existing child review teams don't have to review those deaths anymore.
Got it. Thank you for clarity. Thank you, Assemblywoman, and thank you, Chair.
Thank you. I have another question from Assemblywoman Taylor.
That actually answered my question, Chair, so thank you very much. And thank you, Council.
Thank you. Assemblyman Hibbets.
Thank you, Chair, and thank you, Council. That answered about 4/5 of my question. The one question, just for clarification, which was pretty recently clarified, we're creating a new panel to investigate deaths from fetal to 1. Why the amendment? Why do that instead of leaving it with the existing review committee? Why not just add it to their duties?
Thank you, and Assemblywoman Clara and Thomas for the record. Thank you, Assemblyman. I appreciate that question because that was my question in the beginning also. And what it is that there is not a state that combines the adults with the children. So we had to sever. So the bill that I brought forward back in 2021, we had to sever the infants from the pregnant women. So that's why. It's just not done. Even though the CDC sees a direct correlation to Black, brown, and indigenous mothers and their babies dying before the age of 1, you just cannot equate the numbers with the mothers because there are different things that come into play with it. So the babies have to be in a separate review. So that's why we did what we did.
Thank you. And on follow-up, is there, forgive me for not having a chance to read the entirety of the amendment, but is there some sort of a mechanism to establish communication between the two different investigating groups so that we aren't missing something in the cracks? Because if God forbid, a baby dies at 364 days, it's investigated by one panel. If it dies at 365 days, it would be investigated by a different panel. I just want to make sure that we're not missing anything and there's some sort of connectivity there.
There's nothing, Assemblywoman Claire Thomas for the record, there is nothing saying that we have to do that. But, you know, I would leave it up to the review committees to look at, you know, I could put an amendment in there to say that, but I don't think that, you know, one program is not connected to the other until they can look at it all together. If I'm explaining this the way I think that it should work, at the end, if they want to come back to each other and say, hey, you know, the CDC says that there's a direct correlation, then we should compare notes, then they can do that. But until that time, I don't believe that they can. Or they should. Hopefully that answers.
It does. Thank you.
Thank you for the question. Assemblywoman Gorlow.
Thank you. I have more of a comment that hopefully can help shine some light on with many of the committee members. That what Assemblywoman Thomas is trying to do is have a review that looks at the fetal portion and the infant up to 1 year. That's going to look at children that were born premature. Did they have heart problems? Did they have other birth defects that may have caused that? Was it an extreme prematurity, extreme low birth weight? That's a little bit different than when we're looking at maternal mortality review. We're going to look at more of, did the mom have gestational diabetes? Did she have preeclampsia? Did she have other chronic illnesses that may have caused a problem? Was there domestic violence? Those are the things that that group looks at. Then if you look at my AB 179, they're going to look at what Assemblywoman Thomas is trying to establish, plus also the maternal morbidity mortality review, look at that and then make recommendations on what we can do to improve those birth outcomes so that we're not losing a baby, whether it's in utero or in that first year of life, or looking at mom and finding out ways that we can also improve her health outcomes. So did I kind of wrap that up a little bit for you?
Assemblywoman Clara Thomas, for the record. Yes, Assemblywoman, but there's another key to this, is that are the babies of minority receiving adequate health from doctors and from, the health industry, because we're finding out that moms of Black, brown, and indigenous women are not receiving the same health care. What word am I looking for? They're not receiving the same health care from their doctors as white or Hispanic women. And we believe that it could be, as the CDC has stated, a direct correlation, that perhaps our healthcare providers need to actually look at the health care of Black, brown, and indigenous babies also. So there are disparities in receiving health care among minorities, and this right here is something that, if you heard my statement when I was reading how Nevada has 33% Black women, and those Black women are dying. So there's a direct correlation that maybe the babies are dying at that high rate also. That 2% of Native American Indian are in the state of Nevada, with 22% of them dying. And the babies could be doing the same thing, because they do not receive the same health. Providers are not looking at them in the way they should be looking at them. So this committee would look at everything that Assemblywoman Gorlow said, and exactly to see if the health care providers are providing the good health care that they should for our babies.
Thank you. I remember it's been 11 years since I got pregnant with my first kiddo. And in doing research, I remember being shocked at the disparities of maternal mortality and infant deaths between white women and our counterparts in the BIPOC community. And it's been a decade. So I think it's a great idea to set up a commission to try and quantify what it is that's going wrong, since it's not fixing itself. And that's disturbing. Are there any other questions from the committee before? Yeah, Assemblywoman Newby, please go ahead.
Thank you, Madam Chairwoman, and thank you for bringing this bill. I agree that it's something that we really need to shine a light on. That said, I'm concerned about the amendment and the way that it interacts with 432B in NRS, because that section is on child neglect and abuse. And so I'm just really concerned about removing children from under one in that review panel that currently reviews those things, or deaths of children in that current age bracket. So that would be section 2 of your amendment, where it limits it from 1 to 18 years of age. And then at the end, it essentially says that this committee, that the 432B committee will not review it if the new fetal and infant mortality review program reviews it. And in my mind, the two programs, the two committees are kind of looking at different things with a different outlook. So I wondered if you could speak to that a little bit, and whether or not you think that the same things would be caught or would be reviewed in this new committee, and that's why you took it out, or if you would rethink that.
Before, Ms. Assemblywoman Thomas, before you begin, I'm going to ask legal if you could also potentially weigh on this, because the way that I'm reading it says has already kind of carved out children under 1. So I'm not sure that this addition of 1 to 18 affects that continued review of abuse and neglect of children, the cause of death for a child under 1. That continues to look like it remains in the language?
Yes, Eric Robbins, LCB Legal. Yes, the way the statute is currently worded, if the death of a child results from abuse or neglect of a child who is under 1 year of age, then that's not subject to review of a child death review team under 432B.
So that would be under the review of death from abuse and neglect of a child under 1 is reviewed by what currently?
I would have to look at that and get back to you.
Okay, so I just want to clarify that's not carving out the portion where we're looking at abuse and neglect as the cause of death for a child under 1, right? So it would be just those outside of abuse and neglect. Assemblywoman Thomas, if you want to weigh in.
Thank you, Madam Chair. And Assemblywoman Claire Thomas, for the record, the way that I kind of look at it is that if a child dies, violently from abuse, neglect, then another agency needs to look at that. That would not come under what this bill or what this review committee needs to do. It's just like if the mom died, pregnant mom died from abuse, the Maternal Mortality Review Committee would not look at her death. It's separate and not equal. Let's put it that way.
Yeah, we look at these things in a little bit of a bifurcated manner already, but please go ahead, follow up.
I guess I am confused because in the amendment, it adds, so the original language is review records of selected cases of children under 18 years of age, which means, in my mind, from 0 to 18. And then the amendment adds from 1 to, so now it isn't from 0 to 1, it's from 1 to 18. So I guess my question is that the case? And where, maybe I'm just very confused. Where do the 0 to 1? Because we know that infants die of abuse and neglect under 1 year old sometimes.
Mr. Robbins has a response.
Yeah.
Okay, Eric Robbins, LCB Legal, for the record. So I apologize for earlier. I was confused by the words of the amendment, but looking at the actual provisions of NRS 432B 403, it says that the purpose of organizing multidisciplinary teams to review the deaths of children is to review the records of selected cases of deaths of children under 18 years of age in the state with no modification there. So Assemblywoman Newby is correct here. Currently, the child death review teams do review deaths of children who are under 1 year of age, the way I read the statute, and this amendment would get rid of that.
And then would pull it into a new review committee that was strictly for those infants under age 1. So we'd kind of be defining infants as age 1 and under, and then children would be 1 to 18. And then we would continue to review the cause of death for children under 1 from abuse and neglect under a different section of NRS.
That's correct. The deaths of the children under 1 would be reviewed by this new fetal and infant mortality review program.
In an existing, I'm sorry for this back and forth, but under the existing law, that it's already carved out, unless from the abuse and neglect of a child is the cause of death for a child under 1, in which case it would go where
Eric
currently?
Robbins, that's actually incorrect, and that's a misleading, it's, I mean, I don't think it's intentionally misleading. I don't mean to infer that, but it's just basically, I think that language should appear in green in the amendment, and it appears in black because that is not in the current statute.
Okay, so we would continue to look at non-health related deaths, or specifically domestic violence deaths of children under 1, under this team to review the deaths of children, and then we would specifically call out the new infant mortality review team would be all deaths outside of that for children under 1. Okay, I am clear now. Anyone else with clarifying questions? Yes, Assemblywoman Taylor.
Thank you very much. I'm close. I'm close to being clear. I'm close. So I'm going to say to you what I think we have. Okay, there's currently a team that looks at the deaths of children up through the age of 18, but not enough attention is being paid to that early end, that 0 to 1. And so the intention of this legislation would be to set up a different team specific to that group, to make sure that the attention is being paid to that particular group in terms of their mortality rate and so on, and we're using some of the stats. And so that's why we need a separate one to make sure it's not lost, because right now it's kind of getting lost.
Assemblywoman Claire Thomas, for the record, exactly. And that was the whole premise of this bill, is because they already do a fetal review committee of deaths of all children here in Nevada. But they do not carve out Black.
They don't disaggregate the data.
Exactly. And to me, that's important because of the record that we get from CDC that says it is necessary for us to carve out those things, because it is in order for us to be a society that considers everything in society, we have to look at the racial makeup, because for so many reasons, we are not getting the same health care that our white counterparts are receiving.
If I may follow up, Chair? Yes, please. Okay, so thank you so much for that, Assemblywoman, and thank you for bringing this forward. I should have started with that. And so really, it's the data is being collected, but it isn't being collected in such a way that it can be disaggregated. And so the intention is to collect it in an aggregated manner, or maybe should it be that we mandate that it's collected in that manner from the group that's doing the collecting? Does that get to what the intention of the bill is? I believe in disaggregating data, because then it can be skewed one way or another if we don't look at how how different populations are being impacted. I really truly do. I'm just trying to get my arms around this.
And Assemblywoman Claire Thomas, for the record, this is the whole premise of establishing the Fetal and Infant Mortality Review Committee, is for them to look at those specific things of why our babies are dying at a higher rate than any other race of people. So it's really supposed to be not convoluted. It's supposed to be as simple as, as pie. It's supposed to be that simple. And it's just a matter of, if we did the same thing for the maternal mortality of Black, brown, and indigenous women, it stands to reason that we should do the same thing for our Black, brown, indigenous babies. Just that simple.
Okay. I appreciate the simplification of it. Thank you so much. And thank you, Chair.
Thank you all for the questions. We are all, I think, very supportive of the prospect of and desire of the bill. So grateful for you bringing it forward. Are there other questions from the committee before we move into testimony? Thank you, Assemblywoman. We'll move into support testimony in our physical locations and then move to the phones. If there's anybody who'd like to provide support testimony on Assembly Bill 168, please come up and state your name for the record. You may begin when you're ready.
Good afternoon, Chair Peters and committee members. For the record, my name is Caitlin Gatchalian, Caitlin Gatchalian, and I'm the Government Relations Director for the American Heart Association Nevada Division. I would like to thank Assemblywoman Thomas and Gorlo for supporting this bill. On behalf of the American Heart Association, I would like to express our support for AB 168. The American Heart Association supports this bill in hopes of identifying trends, rates, or disparities in infant deaths, especially for our BIPOC community. Almost 28,000 infants died in the United States in 2020. The 5 leading causes of infant deaths in 2020 were birth defects, preterm birth and low birth weight, sudden infant death syndrome, injuries, maternal pregnancy complications. This bill would show that Nevada is committed to improving birth outcomes. We hope that in support of AB 168, we can create more attention to this problem. The American Heart Association urges you to support AB 168. Thank you for your consideration.
Thank you. Please begin when you're ready.
Marco Rauda with El Faro Consulting. I just want to ditto the Assemblywoman and the last speaker as well. Thank you.
Thank you. Seeing no one else approach the desk in Carson City, is there anyone in Las Vegas who would like to provide? There's nobody in Las Vegas. We'll go ahead and move to the phones. BPS, is there anyone on the public line to testify in support on Assembly Bill 168?
To testify in support of Assembly Bill 168, please press star 9 now to take your place in the queue.
Hello, this is Carissa Pierce, CarissapPearce. I am the Health Policy Manager with Children's Advocacy Alliance, and we at Children's Advocacy Alliance would like to thank this bill for being brought forth to you. We would ask that we urge your support for this bill. We see this as a strong step for future change to understand the challenges that are impacting Nevada infants and ultimately leading to preventable death. We at CAA believe in equitable health care for all Nevada families and children, and this bill promotes equity by investigating the details of infant mortality disparities. It's very important for us to start somewhere to create adequate recommendations for future health care services, and we want to ensure that we are providing the best care for our pregnant parents and infants, especially given the racial disparities that are disproportionately affecting infant and maternal mortality rates. So we urge that you support this. Thank you very much.
Thank you. BPS, please add the next caller.
Hello, Chair and the committee. My name is Shelby Swartz, SHELBIE, SWARTZ from Battleborn Progress, here today in support of AB 168. This week is Black Maternal Mortality Week, which marks a week to bring awareness to Black maternal health. Each year in the United States, hundreds of people die during pregnancy or in the year after. Black women are 3 times more likely to die from a pregnancy-related cause than white women. As for their children, infants born to Black, AAPI, and Indigenous people have shockingly higher mortality rates than those born to white women. We are doing a disservice to these women and their children, but not investigating the causes of these preventable deaths. And we are grateful to Assemblywoman Thomas for bringing this necessary bill. Thank you.
Thank you. BPS, are there more callers on the line in support?
If you have recently joined and would like to testify in support of Assembly Bill 168, please press star 9 now to take your place in the queue. Chair, there are no callers to testify in support at this time.
Thank you. We'll move into opposition on Assembly Bill 168. Is there anyone in Carson City or Las Vegas who'd like to provide opposition testimony? Seeing none, we'd go to the phones. BPS, is there anyone on the public line to provide opposition testimony?
To testify in opposition to Assembly Bill 168, please press star 9 now to take your place in the queue. Chair, there are no callers to testify in opposition at this time.
Thank you. We'll move into neutral testimony. Is there anyone in Carson City who'd like to provide neutral testimony on Assembly Bill 168? Please go ahead.
Good afternoon, Chair Peters, members of the committee. Joanna Jacob on behalf of Clark County. We were neutral on the original bill as written, so I'm testifying neutral here. And I just spoke very quickly with Assemblywoman Thomas. I have a great deal of respect for the work that she does on this issue, and in light of the testimony today, coming up in neutral, just to say we will work with her from the Clark County Department of Family Services and Child Welfare angle to make sure that there's some federal reporting that's required with some of this data that will be collected by this proposed committee. We'll make sure it aligns with those rules, and we'll work very quickly with her, knowing that it's deadline week. I just told her that we were on it, so just wanted to put that on record that we will work with the Assemblywoman on this bill and let you know if there's any changes that we need to make. Thank you.
Thank you. Seeing no one else come to the desk in Carson City and still seeing nobody in Las Vegas, we'll go to BPS for the public line. Is there anyone in neutral on the public line today?
To testify in neutral for Assembly Bill 168, please press *9 now to take your place in the queue. Chair, there are no callers to testify in neutral at this time.
Thank you. I would invite this bill sponsor back for closing remarks if she has any.
Thank you, Madam Chair, and thank you, committee, for listening. This is a good bill. Whether or not we want to clean up the language, and we can do that before Friday, but I just want you to know that this is a very important issue. There are babies in the state of Nevada that are dying, and we don't know why. And I believe that we think we know why is because they're not receiving correct health care. And we need to discover that. This is a study. Unfortunately, it's not something that we can sink our teeth in and say this is the cause of the babies dying. You know, there are a lot of reasons why our babies are dying. But I believe health care might be one of the biggest issues, just like in the maternal mortality review committee discovered. We are not receiving the same health care that we should as our white counterpart. And this is a good bill. Thank you.
Thank you. All right, we're going to close out the hearing for Assembly Bill 168 and move on to the hearing of Assembly Bill 383. Get me tripped up there, Assemblywoman, with your 343, 383. Welcome, Assemblywoman Torres. It's lovely to have you in here again. Please go ahead when you're ready.
Thank you. Good afternoon, Chair Peters and committee members. I am Assemblywoman Selena Torres, and I proudly represent Assembly District 3 in the heart of Las Vegas, Nevada. Thank you for the opportunity to present AB 383 today, which preserves the right to reproductive health care and makes various changes to ensure working-class Nevadans have more affordable and accessible reproductive health care coverage. I will note to the committee, and I do apologize for the tardiness of the amendment, bills have been moving quickly, and I know my committee has been moving things as well. So there is an amendment that should have been submitted, that's already posted on Nellis, and was emailed to you earlier today as well. I'm honored to be here presenting this bill, but recognize that it is under unfortunate circumstances. Nearly 60 years ago, the Supreme Court in Griswold v. Connecticut established a woman's right to privacy and birth control, and it was the beginning of modern-era contraceptive care. Then 5 years later, the Title X Family Planning Program was established to provide federal dollars for family planning services to low-income and uninsured Americans, of which our state received more than $4 million in the fiscal year 2022, and serviced thousands of women. 2010, the Affordable Care Act guaranteed that for the first time, nearly all health insurance plans had to recognize and cover birth control as a preventative health care service. Here in Nevada, we have also been hard at work to guarantee all Nevadans have easy access to contraception. In 2017, we authorized healthcare providers to prescribe a 12-month supply of birth control at a time to make it more convenient for Nevadans to access consistent care. And just last session, we allowed our neighborhood pharmacists the ability to prescribe and administer birth control. But today, we find ourselves at a tumultuous and uncertain point in the progress we have come so far in making. As we approach nearly a year of the overturning of Roe, Nevadans are frustrated, confused, and anxious that just one more judicial decision can overturn healthcare services that they use on a daily basis. In December, a ruling of Deandra v. Becerra drastically reduced the ability for minors to access contraceptive care in Texas. And just last week, an additional case struck down the ACA's requirement for preventative care coverage, with petitioners requesting in the same case to strike all birth control coverage as well. Amidst this confusion, we must provide clarity and assurance to all Nevadans that their reproductive care decisions are protected and that their access to contraception is guaranteed now and forever in the state of Nevada. In addition to preserving this right, we must continue building on our work to make contraception more accessible and cost prohibitive as possible. We know that about 57% of young women ages 18 to 34 struggle to afford birth control, and it's women of color in particular shouldering the economic or social burden of accessing care. This bill makes a very curtailed effort to tackle accessibility for women by empowering community-based solutions and putting necessary care within closer reach of Nevadans. We know that 1 in 5 women who are uninsured typically obtain birth control through a pharmacy, and over 2/3 of women report feeling comfortable accessing their medication at their neighborhood pharmacy. While we gave pharmacists the ability to prescribe contraceptives in 2021, we could expand the number of providers by ensuring pharmacists are reimbursed at the same rates. I'm going to go ahead and do a section-by-section breakdown of the bill as amended. And so I'll kind of be walking through this document. Section 2 establishes the Right to Contraception Act, and Sections 3 to 5 provide key definitions of proposed changes. Section 6 provides a new definition of reproductive health services to broaden the types of care Nevadans receive today and must continue to receive in the future. Section 7 prohibits future state or local entities from enacting any substantial burden to healthcare providers prescribing or individuals seeking any type of reproductive health care. Section 8 establishes a legal framework to review any restrictive changes to reproductive health care and codifies the process by which a person or provider of health care may initiate court proceedings challenging inaccessibility. Section 8 of this bill, as amended, outlines changes to the state plan for Medicaid. Section And so Section 8, subsection 6 establishes a rate for the state plan of Medicaid is expected to pay for translation services upon receiving federal matching funding. This section of the bill directs the state plan for Medicaid to reimburse the dispensing, administration, and monitoring of contraception, including in an outpatient setting. I think additionally it's important to note that the match that is noted by Medicaid is a federal match that we are just missing. Those are funds that we're just not getting right now, so this would allow for us to receive those funds. Section 10 through 19 have been eliminated with the amendment. Section 20 clarifies financial impact on local governments, and Section 21 outlines the effective date of this bill. At this time, I am open for any additional questions from the committee. Thank you.
Thank you for the presentation. Are there questions from the committee? Yeah, Assemblywoman Taylor.
Thank you, Madam Chair, and thank you, Chair Torres. And looking at the amendments, it looks like, and thank you for the grid. It's so much easier to follow. You know, I like the grid. It looks like many of the changes that you were recommending before, now you're no longer recommending those. And can you talk? And you alluded to the other parts of the amendment takes care of that. Can you kind of talk about the rationale behind that?
Yes, and so while I'm still very much supportive of the measures that were noted in that have been stricken from the bill, Assemblywoman Selena Torres, for the record, my understanding is that there is a bill in the Senate that is going to be doing something very, very similar. So in an effort to not duplicate the efforts, recognizing that this bill had other parts that are not in the bill in the Senate, I thought that it would be wiser for me to spend my time pushing this part of the bill and allow for the Senate to do the senator's work.
Okay, thank you. Thank you, Chair.
Thank you for the question. I recently had a conversation about birth control over the counter, and it sounds like by the end of this year we'll have several more options out there than just Costco. All right. Seeing no other questions, we'll move in. Oh, yep, Assemblyman Ornlicker.
Thank you, Chair, and thank you, Assemblywoman, for bringing this important bill. I do have a question about, let's see, it's section 6, 3B on page 3. And this is having to do with sterilization needing the voluntary and informed consent of the patient. And I understand how we need to protect against the abuses we've had in the past against involuntary sterilization. I wonder, though, if it should be absolute. So could there be times where you have somebody who's lacks decision-making capacity, has a medical indication for sterilization? Would this preclude the sterilization if there's a medical reason for it because they can't give voluntary and informed consent?
I would probably defer that question to legal because I'm not.
Mr. Robbins.
I imagine that there's other statutes that impact that, so I don't want to answer wrong.
Eric Robbins, LCB Legal, for the record. I mean, generally, this would not affect any other, or this wouldn't change any existing law about consent to sterilization procedures. It's just saying that that basically the provisions of this bill don't affirmatively authorize or sanction sterilization without the voluntary and informed consent of the patient.
Thank you. And Assemblywoman Selena Torres, for the record, and I think, sterilization as we use it here is often applying to hysterectomies and vasectomies too. So making sure that there would be no law that would prevent an individual's access to that.
Okay. Thank you.
Thank you. Assemblyman Hafen.
Thank you, Madam Chair. Thank you, Assemblywoman, for being here today. I do have two quick questions. One, would this also cover the, I'm going to butcher this medication, mifepristone? Am I saying that right? Mifepristone?
Assemblywoman Selena Torres, for the record, there's nothing in this bill that specifically does with any medication. This, to clarify, is only preventing the local governments from creating any laws that would prevent individuals' access to reproductive health care services. So there's nothing in here that is in fact, the portion that deals with access to miscarriage medication, like the one noted earlier, that, I mean, this does not, my train of thought. So this piece of legislation doesn't have anything to do that would go with anything else that's protected. So it's really just preventative to make sure local governments do not institute legislation that prevents individuals' access to reproductive health care services.
Slightly confused by the answer. May I ask for clarification?
With grace, sir. Yes.
We're also asking insurance to cover.
Assemblywoman Selena Torres, for the record. So no, as you noted in the amendment and in my presentation, so I did strike sections 9 through 19 because my understanding is that there is a bill similar to that in the Senate. So with those changes, this really is requiring local governments, preventing local governments from doing anything that would burden an individual's access to reproductive health care services.
Okay, and then thank you for the clarification. And then the second question was, would this apply to minors? Or would parents have to be either notified or consent.
That's all Selena Toys for the record. This has nothing to do with consent laws on any access to reproductive health care services. This is preventing local governments from burdening access to reproductive health care services. So from local governments saying that you could not access contraception, are making it difficult for patients to access contraception in our communities, making it hard for people to access in vitro fertilization, which is a concern with the recent changes to the right to privacy with the Supreme Court's case, making sure that there's nothing that's preventing or giving any barriers to access to miscarriage that would be implemented by local government. So these are right now as it stands, Nevadans have access to these things. These are preventative measures to ensure that these rights are codified here in the state of Nevada.
Thank you. Any other questions before we move into testimony? Assemblywoman Newby.
Thank you, Madam Chairwoman, and thank you, Assemblywoman Torres, for this bill. I appreciate this new section where you define reproductive health services, and also in the other sections where you've struck contraceptive services and replaced with reproductive health services, understanding that there's so much more to this, to choices that our families make. My question is around the definition of reproductive health services. I know there's a number of other bills dealing with that right now. And I want to make sure that they all kind of encompass the same thing. So could you talk a little bit about the definition that you have in your amendment, please?
Yes, as a Selena Toys for the record. So the definition that was adopted here in the amendment is the exact same language as what I believe is used in some of the other legislation that I've seen this cycle.
Thank you.
Thank you. Other questions? Seeing none, we'll move into testimony. We are going to start in support testimony in our physical location. We happened to lose Las Vegas. It was awfully crowded over there, so it's such a sad day for democracy. I'm just kidding. There was nobody there, and Commerce and Labor needed the room. So we will continue to take folks on the phone if they are trying to attend not in Carson City, but we'll start here in Carson City. Please remember to state your name for the record. You may begin.
Thank you, members of the committee and chairs. My name is Dayla Gibson, Daela Gibson. I am here today on behalf of Planned Parenthood Marmonte. We are here to support AB 383. Birth control is a crucial part of a person's overall health and reproductive freedom and autonomy. In a post-Roe world, it is vitally important that access to birth control remains free from unnecessary restrictions or barriers to access. I urge you to support AB 383. Thank you.
Good afternoon, committee, chairwoman, and members of the committee. My name is Marco Rauda. I'm with El Faro Consulting, representing Americans for Contraception. AB 383 will allow Nevadans to continue to use contraception and contraceptives without fear. It will also make it easier for Nevadans to obtain reproductive health care. So therefore, I urge this committee to please pass. Thank you.
Thank you. Please go ahead.
Chair, members of the committee, Tony Ramirez for the record, TONY-REMIREZ. We are in support of this bill. Thank you. Oh, with Make the Road. I'm so sorry. Thank you.
Thank you. Anyone else coming up today in support? All right, we will move to the phones. BPS, is there anyone on the phone line for support testimony on Assembly Bill 383?
To testify in support of Assembly Bill 383, please press star 9 now to take your place in the queue.
Good afternoon, Chair Peters and members of the Assembly Committee on Health and Human Services. For the record, my name is Donna West, and I live in Assembly District 14. I support AB 383 because in these uncertain times, we must protect the access to our reproductive choices. This bill protects the right to contraception for all Nevadans by preventing any state or local government from enacting any restrictive measures on contraceptive access. Nevadans support reproductive freedom. These decisions are between a person and their provider. I urge your support on AB 383. Thank you.
Thank you. Next caller, please.
Hello, Shelby Swartz from Battleborn Progress. That's SHELBIE here today in support of AB 383. Thank you so much to the chair and the committee for considering this bill. This bill is crucial to protect access to birth control and contraceptives and ensure that undue burdens or restrictions are not placed in the paths of Nevadans seeking to protect their bodily autonomy. This is not simply about birth control pills. This is about expanding opportunities for Nevadans who can become pregnant and ensure that no Nevadan is robbed of their ability to make decisions about their proactive reproductive care. We support AB 383 because the right to access birth control is and should remain a decision between a Nevadan and their doctor. They should have every protection and legal assurance that they will be able to do so without interference. We urge your support for this bill.
Thank you. Next caller, please.
Good afternoon. My name is Jolina Simpson, Jollina Simpson, with Make It Work Nevada. And we support AB 383 to provide additional and unfettered access to our communities to make reproductive health choices that will allow their families to live and thrive in a way that each Nevadan sees fit. Again, we want to thank Assemblywoman Torres for bringing this forward, and we really appreciate this bill and hope you will support it. Thank you.
Thank you. Next caller, please.
For the record, my name is Reverend Michael Willoughby, Willoughby. Thank you to the chair, members of the committee, and Assemblywoman Torres for bringing this important bill. The ability to access affordable, reliable contraception is critical for individuals and families to make decisions about their own lives and future. Access to contraception has been under threat with attempts to restrict it through policies and regulations that would limit access and undermine the reproductive rights of individuals. In Nevada, we believe that every person should have the right to make their own decisions about their bodies, their health, and their lives. We believe that access to contraception is a critical part of that right and that it should be protected and expanded. Studies have shown that access to contraception reduces unintended pregnancies, lowers the incidence of abortion, and improves maternal and child health outcomes. It also empowers families to achieve their educational and career goals as well as plan for their future. That is why I urge you to prioritize protecting access to contraception for all Nevada families. Let's work together to ensure that our state remains a place where families can make their own choices about their health and well-being, and where they can plan and when they choose to have families and choose their futures with absolute confidence. Thank you very much.
Thank you. Next caller, please.
Good afternoon, Chair and committee members. My name is Victoria Ruiz. I am testifying to express my support for AB 383, a bill that seeks to further cement protections for birth control, which is essential in ensuring everyone has access to the care they need. Access to birth control is a fundamental part of a person's reproductive autonomy. It is a vital tool that enables people to plan their families and control their own bodies. Unfortunately, access to this care has been under attack nationwide for far too long. With the passage of AB 383, we have an opportunity to push back against these efforts and ensure that everyone has access to the care they need here in Nevada. One of the most significant impacts of access to birth control is its impact on Latina women and other women of color. These communities have historically faced greater barriers to accessing reproductive health care due to systemic barriers and discrimination, which has led to significant disparities in health outcomes. By reducing barriers and restrictions to birth control, we can help close these gaps and ensure everyone has access to the care that they need. I urge you to support AB 383 and take a stand for reproductive autonomy. Thank you.
Thank you. Next caller, please.
If you have recently joined and would like to testify in support of Assembly Bill 383, please press *9 now to take your place in the queue. Caller with the last digits 266, please press star 6 to unmute your phone. Again, caller with the last numbers 266, please press star 6 to unmute your phone.
Yes, I apologize for that. Now, is this for support or opposition?
You're in support testimony, ma'am.
Or I apologize. Okay, I'm in opposition. I apologize for that. Thank you.
Thank you. Next caller, please.
Chair, there are no other callers to testify in support at this time.
All right, we will come to Carson City for opposition testimony on Assembly Bill 348. Is that right? 383. Dang it. See? 383. In Carson City, seeing no one coming up to the desk, BPS, we will move to the phones. Are there callers in opposition on the public line? Please add the first caller.
To testify in opposition to Assembly Bill 383, please press star 9 now to take your place in the queue.
Hello, committee. My name is Celeste Parks, CELESPARKS. I'm a registered nurse in Nevada, and I oppose SB 383. Pharmaceuticals and manufacturer companies have deceived the public by using the word contraception when they are actually talking about abortifacient. Just like the term reproductive health services is very much of a deceiving terminology when it's brutally slaughtering the baby in the womb. But being consistent with the bill, please be mindful, committee members, that this word contraception also includes RU486, which is the abortion pill, also methotrexate, and with the combination of misoprostol, and also the morning after pill. And also I would, the word person in the bill is that allowing, and I know that there was a committee member that referred to this already, but it's very concerning that would this allow for a child to receive abortifacient without a parental consent. So I oppose AB 383. Thank you.
Thank you. Next caller, please.
Good afternoon, committee. My name is Leslie Quinn, and I oppose AB 383. Abortifacients are not contraceptives. They cause abortion. An abortifacient will cause a miscarriage, and it comes from two Latin words, abortus, meaning miscarriage, and facens, making. Contraceptive, the definition of that is contraceptive is for the prevention of ovulation, fertilization of an egg, or implantation of a fertilized egg in the uterine wall through the use of various drugs, devices, sexual practices, or surgical practices. On page 6, section 9, items 1 and 2, this would force insurance companies to pay for family planning, aka contraceptives and or abortion pills at pharmacies. This bill would also force insurance companies to pay for voluntary male and female sterilization. That is shown on page 4, section 8, 1G. Throughout AB 383, it stipulates FDA approval. However, the U.S. District Judge recently revoked the FDA's approval of the abortion pill. Please oppose AB 383 and respect the sanctity of life. And Roe versus Wade was not taking anybody's ability to have an abortion. It was correcting what the judicial branch did in error. That is the responsibility of each state to vote for abortion. It was not something at a federal level, it's at a state level. So please learn your constitution correctly. Thank you.
Next caller, please.
Good afternoon. My name is Christiane Marsh. I live in Nevada. I'm an immigrant here, and I was born in Brazil. So there was a lot of people saying about that this bill is going to protect minority like me. And I'm here to testify against
We Latinos don't want a more abortion. We Latinos women come here to work and to provide and protect her families. So I'm using my voice today to oppose. I don't want this bill helping facilitating abortion pills that can be sold in pharmacies. This is a dangerous way for our kids. They don't follow the instructions well. We've witnessed many teenagers dying from abortion pills, and the media is not saying about it. So it's very dangerous, this bill. I'm please asking to oppose AB 383. Thank you.
Next caller, please.
Chair, there are no other callers to testify in opposition at this time.
We will go ahead and move into neutral testimony in our physical location, Carson City here. I'm not seeing anybody come up to the table for neutral testimony, so we'll move to the phones. BPS, could you add callers for neutral testimony, please?
To testify in neutral for Assembly Bill 383, please press star 9 now to take your place in the queue. Chair, there are no callers to testify in neutral at this time.
Thank you. I would invite the bill sponsor up. Although we're not going to reopen the hearing portion, we do have one clarifying question from a committee member they'd like to ask in your closing remarks based on some of the testimony. Assemblyman Hafen.
Thank you, Madam Chair, and thank you. We heard testimony both in support and of opposition, discussing various medications, whether it's birth control pill or the mifepristone. I don't know these medications. Mifepristone, so I was just hoping that we could get clarification that based on your amendment, that as you stated, no medications are being included. And I do want to just kind of touch on section, I can't tell if it's section 8, 9, or 10, that requires Medicaid to reimburse for some of this stuff. That could you just clarify so everybody on the phone and in person knows that, are we talking about medications? Are we not talking about birth control? I mean, exactly what are we talking about, just because both support and opposition seem to have something different than what you said. So just like a little bit of clarification for them. Thank you.
Thank you, Assemblyman Hafen, for that question. Assemblyman Selena Torres for the record. So just some clarification for those listening online. Anything that had to do with the Medicaid, except for the language translation portion of this bill, has been stricken. So that's going to be sections 9 through 19. So I think a lot of the concerns that I heard over the phone today were about sections 9 through 19. And with the amendment, and I understand that the amendment was posted pretty late, but with the amendment, that is no longer impacted. What this bill really strives to do is ensure that governments are not burdening our access to reproductive health care. I think that every family should have should be able to make the decision of when to have their family. And that includes individuals that might be seeking in vitro fertilization. That might be individuals that are looking to have access to birth control. So this is just saying that local governments can't do that. I think this is also good lawmaking when I just look at it overall, because, we don't want different local municipalities within our state to have different laws regarding our access to contraception than what another one is. I shouldn't be able to have, access to birth control in Southern Nevada and not access that same access in Northern Nevada. So this makes it sure that it's consistent, and that those provisions wouldn't be able to, those ordinances would not be able to be enacted. I hope that clarifies the question.
I appreciate it. Thank you, and thank you, Madam Chair.
Thank you. Assemblywoman, closing remarks.
Thank you. Someone Selena Torres for the record. I don't know that I really have any further points to make. I just want to reiterate how critical it is that every family has a decision to choose how and when they and if they expand their family. Right? I think about individuals. With the court decision that was made last summer, it's not that we're not having a conversation about abortion right now. We're having a conversation about making sure that other protections that were put into place continue to have. We have consistently had access to contraception in the state of Nevada. Right now, there aren't barriers to access to that contraception, and we should continue to have them. And this is really just saying that is a right here in the state of Nevada, that we can have access to those things. And I look forward to continuing this conversation. And urge your support of AB 383. Thank you.
Thank you, Assemblywoman. We'll go ahead and close the hearing on Assembly Bill 383. I got it right that time. And we will move on to our last and final agenda item, public comment. We will and have public comment here in Carson City and on the phone. We are limiting public comment to 2 minutes to ensure that we have fair access to that time. If you have written public comment, you may submit those in a variety of ways, all of which are listed on the agenda. Is there anyone in Carson City who would like to provide public comment today? Seeing none, BPS, is there anyone on the public line to provide public comment today?
If you would like to provide public comment, please press star 9 now to take your place in the queue.
Good afternoon, Chair Peters and committee. I raised my hand to testify in support of Assembly Bill 383, and this is Dora Martinez, and I'm really sorry I was late to get in. Can I please, I'll be really quick.
Hi, Ms. Martinez. Yes.
sorry.
Would you just clarify whether you're in support, opposition, or neutral on that bill?
I am 100 in support of Assembly Bill 383. It's a common sense bill, and as a person with a disability, it's one of the tools in my toolbox. And just for some people to understand, birth control is also used to slow down Miss Aunt Flo. Sorry, guys, but that's what it's for as well. So I appreciate the amazing Assemblywoman Selena Torres for all of her hard work, and thank you so much, Madam Chair Peters. You're the best. Thank you. Enjoy your day.
Thank you. We will go ahead and classify that as support testimony on Assembly Bill 383. We apologize for that technical difficulty. BPS, next caller, please.
Yes, my name is Leslie Quinn, and I'm here to give public comment. I would just like to say that recently in Tennessee, our Vice President Kamala Harris, talking about control, did not like how some of the legislators were removed for using a bullhorn, and was very adamant about that. And I'd like you to also, moving forward, remember on April 6th, Assemblyman Gray was disrespectfully silenced by Chairwoman Miller during a gun control hearing for SB 355. Assemblyman Gray was simply doing his job, representing thousands of his constituents by being their voice, their First Amendment voice, their freedom of speech voice, also their right to petition the government. But these freedoms were unfairly and unconstitutionally silenced by Assemblyman Woman. So I think any of you legislators that would be a chair, that you would use your legislation and do it constitutionally. Because when we're talking about control, we're supposed to have freedom of speech. It's a First Amendment right, and I'd appreciate that you all would continue to do that as you are talking about the right and freedom of reproduction and the right for a woman to use contraceptives. Being a woman, I understand what you're doing. I just am somebody who is pro-life and think people have the other choice as well. Thank you very much.
Thank you. Next caller, please. Please remember to state your name for the record.
If you have recently joined and would like to provide public comment, please press star 9 now to take your place in the queue. Caller with the last digits 535, please press star 6 to unmute your phone.
My name is Taiwan Thirdgill, Tyjuan Thirdgill, Thirdgill, here to testify in support of AB 383. Chair Peters, members of the Assembly Health Committee, thank you for holding this hearing on Assembly Bill 383. This legislation sponsored by Assemblymember Torres aims to establish a right to contraception and expand access to contraception for all Nevadans. My name is Taiwan Thirdgill. I'm an organizing manager with NARAL Pro-Choice America, working here in Las Vegas to mobilize our Nevada members this session. I'm here to register our support for AB 383. NARAL Pro-Choice Nevada is a nonprofit advocacy organization.
I'm sorry.
dedicated to advancing reproductive
We're
freedom.
in public comment at the moment. The support testimony has occurred. If you were not in the waiting room and missed the time to raise your hand, as some of our previous caller did, I would encourage you to send your testimony in writing. We will accept that up to 24 hours after the hearing today. But right now we are in public comment, which is outside of the hearings that we had today.
Gotcha. So we were in the waiting room, and they didn't stream the hearing to our to Grant Sawyer.
Oh, wow. Okay.
So we were actually here waiting to testify.
Thank you for letting me know that. Yeah, we did not see anybody in that room and had to give it up to Commerce and Labor, where they had a hearing for another bill. We'll let you proceed, and we can classify this as support testimony on that bill. We apologize for that technical inconvenience. Please go ahead.
Gotcha. NARAL Pro-Choice Nevada is a nonprofit advocacy organization dedicated to advancing reproductive freedom through legislative, political, and community organizing. NARAL has organized in Nevada like myself, allowing us to organize directly in the community. NARAL has been operating on the ground in Nevada since 2016. We began with 900 members, and through door-to-door outreach, phone banking, online actions, and community events, we've recruited more than 48,000 members since that time, and we are growing every day. NARAL believes that everybody should have access to contraception, no matter where they live, where they work, how much money they make, so they can plan our families and our futures. Last year, the Supreme Court anti-choice supermajority overturned Roe v. Wade, causing untold harms to millions of Americans who lost their freedom to make their decisions about their lives, bodies, and futures. In a concurring opinion, Justice Clarence Thomas wrote that the court should reconsider the Supreme Court precedent that guaranteed the right to contraception. Some anti-choice lawmakers have refused to rule out the possibility of banning some forms of contraception in their state, even though the public overwhelmingly supports access to contraception. Make no mistake, overturning Roe was a part of a decades-long campaign waged by anti-choice movement to end the legal right to abortion and decimate reproductive freedom, which includes the right to contraception. The threat to reproductive freedom has never been more real, and the stakes have never been higher. That's why NARAL is proud to testify in support of AB 383 and appreciates Assemblymember Torres for bringing this legislation forward. NARAL urges this committee to vote in favor of AB 383 without delay. Thank you.
Thank you for your testimony. And again, we apologize for the miscommunication about the room in Las Vegas. BPS would take the next caller, please, and let's check in with them on where their testimony should lie today.
Caller with the last digits 288, you may begin for public comment.
Yes, hello, my name is Minero Martinez, and I'm an activist from Las Vegas, Nevada. I'm here with Pro-Choice Nevada to support bills. As a Latina woman and Indigenous woman, I believe it's very important to provide and help a woman, so all color nationalities, to be able to have access to prescription anti-conception programs. Especially, we are the more marginalized communities in the country, the United States. I'm strongly supporting and ask you to support this bill. Thank you so much.
Thank you. We're going to go ahead and reclassify that as support testimony on Assembly Bill 383. And again, apologize for that technical confusion. Is there anyone else on the public comment line?
Chair, there are no other callers choosing to provide public comment at this time.
Thank you. Well, that's the end of our day today, folks. Thank you all so much for your time today. We will have a meeting on Wednesday. It's the 12th, and that will be at call of the chair, but likely around the same time. I will make sure we get notices sent out to folks before we begin. But please be ready for a good, healthy work session and another bill hearing. And with that, we are adjourned.